Thank you, Mr. President. Mr. President, like my colleagues here today, I rise to talk about the Republican effort to repeal and replace the Affordable Care Act. I've been talking to a lot of people in Minnesota who have health insurance thanks to the Affordable Care Act, or whose lives were changed by the protections in the ACA that benefit every American. And frankly, they're scared. Hardworking people for whom this is literally life or death. If their health insurance is taken away, they do not know what they're going to do. So today, on their behalf, I have one request for my Republican colleagues. Show us your plan. You know, your health care plan. You must have one. We would like to hear it. We would like to see it. Now, you can understand the question, right? Because if, say, your child had cancer and the Affordable Care Act was the reason you could get health insurance, you wouldn't want to rip up the ACA before knowing what would replace it. I am not the only senator with constituents whose lives are on the line here, so I just know that you don't intend to rip up the Affordable Care Act and leave them with nothing. You've got to have a plan, right? So let's just see it. Last week, President Obama said that if Republicans produce a plan that's quote, demonstrably better than Obamacare, he'd support it, and so will I. Just show it to me. Now, President-elect Trump clearly has a plan. He laid it all out during his campaign. His plan was, he said, to quote, this is a quote, repeal Obamacare and replace it with something terrific. That's what he said. And then he went into a little more detail and explained that something terrific would be, quote, so much better, so much better, so much better. Terrific. So much better. That sounds great. Let's see it. One of Trump's top advisors said on MSNBC, "We don't want anyone who currently has insurance to not have insurance." Great. Neither do we. Speaker Ryan said that there will, quote, be a bridge so that no one is left out in the cold, so that no one is worse off. That is wonderful. No one being worse off is exactly what we want to see. Now, I'm sure Speaker Ryan's staff was mistaken when they later told a reporter that the no one worse off applied only to the transition period, not to the replacement period. Show me the plan. Please, please show me the plan that keeps coverage for the 20 million people who have gained coverage, that would continue to bend the cost curve so the cost of the entire healthcare system continues to grow less quickly than it did before ACA was adopted. The plan that would ensure that nobody gets denied coverage when they need it, or has to unfairly pay more than someone else because of their gender or of a pre-existing condition. Show me that plan. Now, I know that Republicans have put forward some different plans, a lot of different plans. But a lot of plans is not a plan. A lot of plans is not a plan. We want to see the plan. You know, the one you've been working on for 6 years. I was here in 2009 when we passed the ACA. I know how hard it was. You know, if I could, let me offer you something. Some of your Republican friends actually did come up with a health care plan a while ago. It all started at the Heritage Foundation, which is a bona fide conservative think tank. And over at Heritage, they didn't like the idea of, say, a single-payer health care insurance where the government is everyone's insurer. So what they wanted to come up with was a way to use the magic of the marketplace to solve the problem of providing everyone access to insurance. And here's what they came up with: a three-legged stool. Now, the first leg, insurance companies can't deny coverage to people with a pre-existing condition and can't charge them more. Now, we can all agree on that, right? President-elect Trump and I agree on that, for sure. It's a great idea, a great idea. But there's a catch. If you can't turn people down because of pre-existing condition and can't charge them more, well, then everyone will just wait to buy health insurance until they get sick and need care. But the whole idea of health insurance is that at any given moment, most of the people paying premiums are healthy. So their premiums cover the costs for the people who are sick. If the only people with insurance are sick, the premiums will skyrocket. So you need a way to get healthy people into the system to bring the cost of insurance down, which brings us to leg number 2. Everyone has to be insured, otherwise known as the individual mandate. Everyone has to be insured. Heritage Foundation said that. They call it the free rider syndrome. They said, no, everyone has to be insured. Now, this is what conservatives now say they hate, that the government says that everyone has to buy insurance, but if you have to sell everyone insurance, then everyone has to buy it or the cost explodes. Now look, if you've got a better way to keep people covered and keep costs down,